The World Health Organization has ruled out any change in timing or location of the upcoming Olympic Games in the Rio de Janeiro, shunning the call by doctors and scientists to shift the event over the Zika virus. Well, for more perspective on this, we have joining me via Skype a spokesperson of the WHO, Nyka Alexander. Good to have you join us on the News Hour on the World Today at this moment. So why is the health organization taking this position, ignoring the threat of the Zika virus?
Actually, I think it's quite the opposite. Being aware of the threat of Zika virus, with all the consultations that we continue to do with the experts in vector control, in children's health and maternal health, that is why we even know what Zika is, because of the consultations we continue to do. And as part of the process that WHO goes through in evaluating an emerging threat like this, we look at what's a good way to stop it. Would stopping travel stop this disease? And our specialists say no, stopping travel would have a huge impact on so many other aspects of people's lives and health without being able to really stop the transmission of this disease. What is important is for people to take measures to control the mosquito populations in their communities, personal decisions to try to make sure they don't get bitten by mosquitoes and become infected with Zika and then transmit it back to members of their family if and when they travel back to their home countries.
So what strategies are being adopted now to, well, control the spread of the Zika virus?
It's very much related to two things: to mosquito control, or vector control as we call it, for governments to work with communities and individuals to make sure that their homes are not breeding grounds for the mosquito that carries the Zika virus, and also for the individuals to take the measures they need to take. It's important to remember that Zika, for most people, is not dangerous, but for some people, for pregnant women, it is an incredibly dangerous disease that can have terrible consequences on the fetus. So for most people, Zika is mild, but for one category of people, it can be really terrible. So pregnant women are asked or suggested not to travel to an area where there is ongoing Zika virus, or if you live in a country where there is ongoing Zika virus, you must protect yourself from mosquito bites so that you can protect yourself as much as possible from the virus. We've also learned that Zika can be transmitted sexually, so it's important for people to practice safer sex so they do not transmit the virus to their partner, especially if she is pregnant.
All right, looking at what you've mentioned, you're mentioning pregnant women as a susceptible or vulnerable groups to this Zika virus, but the Rio de Janeiro Olympics will have large visitors from countries around the world. How do you guarantee their safety in terms of not being susceptible to the Zika virus?
So we cannot guarantee their safety. It's something of everyone working together that can improve safety, but we cannot guarantee it. One thing we know, again, is pregnant women should not go to Rio for the Olympics, no matter for whatever reason. The advice is not to travel, and that's the same as many countries. They're also suggested to speak with their own healthcare provider so they can come to a decision themselves. For the individuals, for the athletes who are competing, for the visitors, and for the people who live in Zika-affected areas, we're getting back to those recommendations we said before. Try not to get bitten by mosquitoes. Practice safer sex so that you do not become infected with Zika. And most people who have Zika won't know they have Zika. So when you get back to your country, continue to wear mosquito spray, insect repellent, so that you don't have a mosquito bite you and then pass it on to somebody else.
Nyka Alexander, spokesperson of the WHO, thank you very much for your contributions on the World Today.
Thank you.